Joey.
We've got to talk about birthing in the mountains. There's been too many roadside births and people being transferred because the hospital's been closed. We've got to do something about this. We're going to fight to keep our hospital maternity unit open. Cara, what happened with Joe?
Joe here was born at Katoomba Hospital 3 years ago, and 2 days after he was born, the hospital was closed for the day without warning, and it wasn't something that I was aware could even happen at the time. If I had gone into labour 2 days later, I would have called the hospital, and they would have sent me down to Nepean Hospital because Katoomba Hospital was closed for the day, and he most likely would have been born on the side of the road, possibly on the side of the M4 motorway. Because as it was, he was born within about an hour of me arriving at Katoomba Hospital. So for me, going to Nepean Hospital is just not an option. I'm not prepared to have my baby in the car by the side of the road. That's just not good enough.
So what choices do I have in terms of giving birth in the mountains?
Well, at the moment, we've got a shortage of midwives, and even if you can afford the midwife, it's around $4,000 to have a home birth. And currently at the moment, we're still having temporary unpredictable closures at the local hospital. So if you go into labour on a particular day where there's no obstetrician, you will get transferred the hour trip down the mountain to Nepean.
I think one of the important issues too is that sense of community that you have when women are able to birth in their own communities. Sending women down to Penrith to give birth in a strange environment not only places a lot of undue stress on them, but also on their families. I have older children that I wanted to meet their new baby brother, and that would involve a 2-hour round trip just to bring them to the hospital for a short visit. And that's really isolating, for a woman that's left in hospital by herself with no one close by.
So where do we go from here?
Well, the Katoomba Maternity Coalition is currently fighting to get a primary midwifery unit up there, which means each woman will have one midwife follow her through antenatal, the birth and the postnatal period.
The World Health Organization recognises a lone midwife as the most appropriate carer for a normal, healthy, pregnant woman during labour and birth. An obstetrician is only required if a complication arises during pregnancy or during labour. Katoomba needs a primary midwifery unit because obstetricians are in short supply. To make the birth unit in the mountains sustainable, we need to make it a primary midwifery unit. It's a completely safe option for healthy pregnant women in the mountains. Women who develop complications will need to see an obstetrician at Nepean. But for most women, birthing with midwives at Katoomba Hospital will be a safe option. Keep birthing local, keep birthing in the mountains.